COVID-free, and touch wood, I want it to stay that way.
A rare moment of relief under the shadow of Wincourt Care Home's memory tree. 2 names were added when 2 residents were lost.
All together now.
After an outbreak earlier in the pandemic, they believe was caused when a patient was discharged from hospital carrying coronavirus. Would you accept a COVID-positive patient from hospital into this home?
No. At the moment, we're COVID-free. I wouldn't want to bring COVID residents back into this home.
It's an issue that caused huge political rows.
Does the Prime Minister accept that the government was too slow to protect people in care homes?
Prime Minister.
We brought the lockdown in care homes ahead of the general lockdown.
But while Scotland changed its rules requiring patients to test negative before discharge to care homes, in England the latest government guidance says care homes play a vital role in accepting patients discharged from hospital because recuperation is better out of hospital, and some of these patients may have COVID-19. The question some care providers in England are asking is whether discharging patients from hospital who have coronavirus into care homes is the right approach, no matter how stringent their infection control.
Now I know we all love this one, so sing it as loud as you can.
As cases pick up and with winter coming, a senior clinician has told us it could become common for patients with COVID to be discharged into care homes in England.
The last time around, we saw the hospital system under pressure, and part of the response of that was to try to accelerate and escalate discharges into care homes. If we see similar pressures on the hospital sector this time around, then it will be commonplace under the current guidance that people who are COVID positive will be discharged back into care homes.
The UK government guidance says no care home will be forced to take COVID patients, but providers enter into contracts with local authorities. We've seen one from Trafford Council, which includes arrangements for fast-tracking patients out of hospitals. The leaked Trafford Council contract sets out how care homes will receive patients within 2 hours of them being identified by the hospital as ready for discharge. And some of these patients, it says, may have COVID-19, whether symptomatic or asymptomatic. A source at a national care home provider has told us that they've tried and failed to challenge contracts that expect them to take patients with coronavirus, and that they feel under pressure. They say that a combination of discharging COVID-positive patients into care homes and the struggle to get staff routinely tested is a disaster waiting to happen. Our source at a national care provider says after signing some contracts, ethically and operationally, it's difficult to refuse a patient who's arrived in an ambulance at the care home door, as many could die from the back and forth. There's an expectation, they say, and pressure to accept all patients. Wincourt provides palliative end-of-life care, so isn't affected by this particular contract. Trafford Council says care homes can refuse patients and says the well-being of patients being discharged is its primary concern, and the alternative would be to leave them in hospital with a higher risk of infection. Today, the government pledged more than £500 million towards infection control in care homes. They hope here for some cash towards staffing to avoid the risk of hiring in. Infection control, and don't forget testing, vital if COVID patients are to flow into care homes again. Can you create a red zone like they have in hospitals in a care home environment?
It's very difficult. I think in maybe some purpose-built homes, they may be able to do that. But we, as you can see, we are a homely home.
Would you characterise the testing system at present?
I think it's shocking.
In England, the system assumes that discharging COVID patients to care homes can be managed, but even facing financial pressures, it's not a risk this home is willing to take.
And the Department for Health and Social Care sent us a statement in response saying, our priority is to ensure that people are discharged safely from hospital to the most appropriate place and that they continue to receive the care and support they need. And it goes on, no care home will be forced to admit an existing or new resident to the care home if they do not feel they can provide the appropriate care. Well, joining me now from North London is Helen Wildbohr, who's head of the Relatives and Residents Association, a charity for older people needing care and their families, and consultant geriatrician Professor Martin Vernon in Manchester, who is the NHS England National Clinical Director for Older People from 2016 until 2019. Helen Wildbohr first. This idea of rapid discharge of patients who may even test positive for coronavirus back to care homes, is this another disaster waiting to happen, or is it just sensible, practical policy in a pandemic?
I think this news will be very concerning for people living in care and their families in what has already been a really challenging period. It raises many questions, not least what kind of safeguards and protections will be in place to support the person being discharged and the home, to ensure that the person with COVID gets access to the right treatment and support in the care home, to protect the care staff from the risk of catching the virus. And presumably these are homes with other residents living in them. And so how will the home protect those other people and avoid spreading the infection around the home?
Well, Martin Vernon, perhaps you can answer some of those questions. I mean, does this inevitably mean thousands more deaths potentially in care homes, or are elderly patients always better off out of hospital?
Well, I think it's a very difficult balance to get right. We know that whenever somebody goes into a hospital, it's usually for very good reasons. The important thing about older people entering hospital as an emergency is that they stay there as long as they absolutely need to, but then are discharged as quickly as possible. But the important thing here is, particularly regarding care home residents, is that their recovery may well be prolonged. And because of the way that the testing system is currently working, we don't necessarily know at the point of discharge whether that person has coronavirus. And older people in particular don't typically display the classic symptoms of coronavirus. So often have either no symptoms that are immediately obvious or very subtle signs and symptoms. If we had very rapid turnaround of testing, it would be much easier to manage that risk at the point of discharge. And I think we're in a very different place now than we were in March, when we didn't have testing ability. In fact, it was stopped very early in the pandemic for care home discharges and then restarted again over the summer. So we can anticipate this and we can mitigate to some extent. And I would hope that we are able to ramp up that testing capacity to get answers very, very quickly, not just for patients, but also for staff as well, as already been made point clearly.
Well, Helen Wildbohr, should care homes simply refuse to take an elderly patient who's tested positive for COVID, who's come back from hospital?
Well, I think the care homes will have to look on an individual basis about that person, but also for individual care homes to think about the risk assessment that needs to take place and to ensure that that discharge and the admission into the care home can be done in a safe way, so that that person can have their care needs met. If they have COVID, are they able to get the treatment that they need in that care home? But also to put in place protections for the other people living in that care home. And we've ended up in a perverse situation with residents being told that they can't see their families due to risk of infection from visitors, but their home will be admitting new residents who are known to be carrying the virus. And that's going to perpetuate the problem of lack of visiting. Each new COVID positive admission will close that home down to visitors. And our helpline is hearing about the devastating impacts that lack of visiting is having on residents. And we've started a campaign to end isolation in care for the people who are at risk of the virus. There's an even greater risk to some people, of their mental health deteriorating to such an extent that they are losing weight, losing speech, giving up on life.
Martin Vernon, obviously the pandemic's taking a terrible toll both mentally and physically, but are you confident that lessons have been learned in government from the first wave in terms of how care homes are managed? I mean, what happened to the protective ring, for example?
No, I'm not confident at all. I think the discharge guidance that's been issued in August, as was referred to at the top of the package, is very much putting a lot of pressure on the system to expedite discharge. Not necessarily a bad thing, but it has to be done in a way that is safe and appropriate for all people. And in particular, I think the rapid discharge into care homes suggests that the earlier lessons about managed and safe discharge have not been learned at all. And I think that the new criteria that have been put forward by government are really not particularly well thought through, not sensitive to the needs of care home residents with their particular vulnerabilities, and also not sensitive to the environments that care homes provide.
OK, Martin Vernon and Helen Wildball, thank you very much for joining me.